So you've probably been there before. A sore back, stiff neck, maybe you tweaked something lifting or sleeping wrong, and you're standing in your kitchen wondering, do I grab the ice pack or do I grab the heating pad? It's one of the most common questions we get in the office, and honestly, most people get it backwards. Choosing between heat and ice seems simple, but the right choice at the right time can make a huge difference in how quickly your body can actually recover. Let's start with the basics. Ice is best when there's inflammation, when there's an inflammatory process, swelling or acute pain. Think of things that just happened. You just strained your back lifting something, or you twisted your ankle, or someone woke up with a sharp muscle spasm that's just angry and inflamed. Cold constricts blood vessels, which slows down fluid buildup in those joints and in those areas, and it reduces the inflammation. It also numbs the area and calms irritated nerve endings. In physical therapy, this is called cryotherapy, actually, and research consistently shows that short bursts of cryotherapy, about 15 to 20 minutes at a time, are the most effective for acute types of injuries or flare-ups. After that, though, the body starts to respond by pushing blood back into the area. So longer sessions don't actually help, and they can actually slow recovery a little bit more. So what we say is about 10 to 15 minutes is what we basically recommend, and then taking at least 15 minutes off before going back to that ice. Now, heat is best when the pain or stiffness has been around for a while, more chronic conditions like tightness-based issues. Heat relaxes muscles, and it actually improves blood flow and helps the tissue start to loosen up a little bit. It's great before activity or stretching, and especially if the area feels stiff or achy. Here's where most people get confused though. Not all heat is the same. There's dry heat and there's moist or wet heat. Dry heat, things like electric heating pads or heat wraps, warms the surface tissue but doesn't penetrate deeply. It's convenient, but if used too long, it can start to dehydrate tissue. And sometimes it makes that soreness worse and brings more inflammation towards that area afterwards. Moist or wet heat, things like lukewarm shower or a hot towel, or things like moist heating packs, conducts heat deeper into those muscles and joints, and it helps increase the elasticity more in that tissue and promotes circulation in that tissue without actually over drying the skin. Clinical studies will actually show us that moist heat tends to provide faster pain relief and deeper muscle relaxation, especially for things like low back pain and chronic muscle tension. That's why in most chiropractic settings, or like even rehab settings, we use moist heat over dry heat whenever possible. So to recap, use ice for things like acute injuries, things that are really, really inflamed, swelling, flare-ups, things like that. Use heat for things that are a little bit more chronic tension, stiffness, or muscle soreness. And if you're unsure which to use, it's usually safest to start with ice for the first 24 hours, 48 hours, and then to transition to something like heat as inflammation settles in, and to use maybe even wet heat in those situations. One mistake I see often is people using heat right after an injury because it starts to feel a little bit better, and while you have it on there, it actually does feel a little bit better and a little bit more soothing. But if inflammation is still active, that extra blood flow can actually make swelling and pain worse over time, and it can make that injury actually prolonged as well. So on the other hand, relying only on ice for weeks at a time can slow healing by limiting circulation if the process is not totally inflammatory. The goal is to balance though. Reduce inflammation early and then restore movement, motion, and blood flow as much as we can as the body starts to recover. And remember, these tools help manage symptoms, but they do not fix the underlying cause. If you find yourself needing heat or ice all the time, that's a sign that there may be something deeper, mechanical, or an alignment issue that needs to be actually addressed. So the next time that you're actually wondering which one to grab, the heat or the ice, think about what's actually happening in your body. Is it new? Is it swollen? Is it inflamed? Go with ice. Is it tight? Is it sore? Is it stiff from overuse? Go with heat or moist heat. Use both strategically, not just habitually, and you'll support your body's natural healing instead of just chasing comfort. If you have any questions regarding any of this stuff, though, obviously always ask your doctor, ask us in the office, and we'd be more than happy to help you guys. Please like and subscribe to our channel. We'd be more than happy to help with anything upcoming as well. If you guys have any suggestions for other videos or things that you'd like to hear on, please let us know. Thank you very much.